Please skim the article, Outcomes Associated with Post-Operative Delirium After Cardiac Surgery by Mangasson and colleagues. The researchers in this study were interested in the factors associated with delirium after cardiac surgery. The purpose of the study was to examine the effect of post-operative delirium on 5 outcome measures in patients who had cardiovascular surgery with the use of cardiopulmonary bypass, and they included length of post-operative stay, prevalence of falls, discharge to a nursing facility, including skilled nursing facility, long-term acute care facility, or rehab center, discharge to home with home health services, and use of inpatient physical therapy. The researchers searched the electronic medical records of 656 patients who had cardiac surgery during the period of time from January of 2011 through October of 2011 at a medical center in North Carolina. The surgical procedures included coronary bypass grafting, valve replacement or repair, and a combination of coronary bypass grafting with valve replacement or repair. Patients who had surgery without the use of bypass were non-ambulatory, in the ICU of more than a month after surgery, or who died during surgery or during the post-op stay were excluded from the study. A patient was considered to have had post-operative delirium if at least one of the following indicators was noted in the records as a new onset condition after surgery: encephalopathy, delirium, confusion, or altered mental status. The data collection instrument included demographic information, 10 comorbid conditions, and tobacco use in the prior 6 months, length of bypass time, estimated blood loss, and medications during the hospital stay. Outcome measures included falls, use of physical therapy during the hospital stay, hospital length of stay, and discharge destination. Now consider Table 3. Reading across the row concerning occurrence of falls, you can see that there were 15 falls, or 2.3% of the 656 patients. 10 of those were in patients who had delirium, or 6.2%, and 5, or 1% of those without delirium, and this is significant at the p less than 0.001 level. The odds of a patient with delirium falling was 3.95 times more likely than those patients without delirium, and the confidence interval of 1.15 to 13.60 supports this fact since it does not cross 1. Reading across the row concerning discharge to nursing facility, you can see that there were 128 patients discharged to a facility, or 19.5% of the 656 patients. 72 of those were patients who had delirium, or 44.7%, and 56, or 11.3% of those without delirium. And this was significant at the p less than 0.001 level. The odds of a patient with delirium being discharged to a nursing facility was 4.31 times more likely than those patients without delirium, and the confidence interval of 2.71 to 6.84 supports this fact since it does not cross 1. Reading across the row concerning discharge to home health services, you can see that there were 104 such discharges, 19.7% of the 656 patients. 36 of those were in patients who had delirium, or 40.4%, and 68, or 15.5%, of those without delirium. And this was significant at the p-level of less than 0.001. The odds of a patient with delirium being discharged to home health services was 2.64 times more likely than those patients without delirium, and the confidence interval of 1.56 to 4.47 supports this fact since it does not cross 1. Reading across the row concerning the use of physical therapy, you can see that there were 214 instances, 32.6%, of the 656 patients who required physical therapy. 104 of those were in patients who had delirium, or 64.6%, and 110, or 22.2%, of those without delirium. And this was significant at the p less than 0.001 level. The odds of a patient with delirium having physical therapy was 3.35 times more likely than those patients without delirium, and the confidence interval of 2.08 to 5.42 supports this fact since it does not cross 1. Reading across the row concerning the mean length of stay, you can see that the mean length of stay was 6.2 days, with a standard deviation of 3.6 days for the entire sample. And those with delirium had a mean length of stay of 8.3 days, with a standard deviation of 5.6 days, and those without delirium had a mean length of stay of 5.5 days, with a standard deviation of 2.1 days. And the difference was significant at p less than 0.001. The odds of a patient with delirium having a longer length of stay was 1.38 times more likely than those patients without delirium, and this confidence interval of 1.27 to 1.49 supports this fact since it does not cross 1. Now I hope you understand the use of odds ratio in conducting research.